Good morning, everyone, and welcome to the latest in our Financial Empowerment Series, Additional Tools for Homeless Service Providers. My name is Jason Austin. I'm the membership organizer with the Seattle-King County Coalition on Homelessness. We are partnering with Hopelink to provide this training series to you. This started as a workshop back in July that was then spun off into sort of a rolling case manager training series. We want to provide a space here once a month on the last Wednesday of every month to review some of the tools that are located in the Your Money, Your Goals toolkit and kind of use it as an excuse to share resources and talk about ways in which we can have conversations about income and public benefits with the people that we serve. This training today is going to go for about an hour. We're going to discuss savings as an umbrella topic. That's going to include what to be thinking about when preparing for tax season, as well as what to understand in terms of asset limits. Folks often get small gifts during the holiday season, which is an opportunity and can also cause some stress. Folks might be worried about losing their public benefit eligibility. Folks might not know which financial instrument they should put that little bit of money into. So we're going to talk about savings with an eye towards helping the folks you serve. And I think at this point, I'm going to hand things over to Emily Goodright and the rest of the housing case management staff at Hopelink, who is going to be facilitating this training. Emily, thank you so much for being with us here today.
I think Joy is going to kick us off today.
Hi, my name is Joy Horwachuk, and I will be helping facilitate this brief training today with my co-trainer, Anna Austing. Next slide. There's our names. So this is a disclaimer that the CFPB, Consumer Financial Protection Bureau, that created this curriculum and toolkit, we are not members of them. We are not a part of their employees of them or agents, and any views, advice, or opinions that we express during this training do not reflect the Bureau's opinions or views. So it's just a curriculum that we're sharing with you to see what you can do with it, because it's been great with our clients. Next slide. And now Anna is going to kick us off.
Hi, good morning, everyone. Thank you all for tuning in with us today. As Jason and Joy have stated, we're going to talk about Module 2, savings. So we're going to go over savings plans, savings and asset limits, finding a place for savings, and savings at tax time. So next slide, please. All right, we're going to jump right into it. Throughout our training, as we've done with previous trainings as well, we're going to be asking for some engagement in the chat to get our minds flowing and to have a virtual conversation as much as possible. So our first question for the chat is, what are savings? So if you'll please go ahead and list in the chat what your definition of savings is. There's no wrong answer, and I'll give some time for people to formulate a response and type it out in the chat. I'm seeing savings are funds set aside for future needs. Absolutely. Money above and beyond bills could be prudent reserve, could be rainy day funds, etc. Yes. Money set aside for emergencies. Money set aside for emergencies. I'm seeing that. Future plans. Awesome. A collection of money on reserve. Savings means to me survival for the next day. Absolutely. Great point. Putting money set aside with the intention to not use it unless you absolutely have to, right? An emergency fund, great point. So the Consumer Financial Protection Bureau defines savings as exactly what people are saying in the chat: money you set aside today to use in the future. So my next question is, what are some examples of emergencies or unexpected expenses that might pop up in someone's life? So if you could list that in the chat, any financial costs or financial burdens that might be unexpected. Car repair, absolutely. Loss of employment, medical bills, yeah. Medical expenses, absolutely. More folks are saying that in the chat. Child school needs, that's true. Unexpected children, yes, absolutely. Home repairs, very true. Stolen or lost items, absolutely. Loss of job, car repair, an unexpected bill, absolutely. I know we've seen that with folks that we've worked with, and I know we've seen it in our personal lives as well. So out of these expenses that you all have listed, some great examples, how many of these can be handled, or which ones can be handled with $1,000 or less? A phone bill, yeah. It is all dependent, absolutely. Sometimes car repair, depending on the repair, utility bills. I'm seeing food needs, absolutely, gas. School supplies, sometimes certain childcare costs, depending on the childcare cost. Clothing, absolutely. A lot of great examples of what could be covered with $1,000 or less. There's often this idea or quote unquote conventional knowledge that folks need to save 3 to 6 months worth of living expenses to feel like they have a solid safety net. But as we've discussed, we can see that even having $500, $1,000 saved can really help people out in unforeseen financial burden situations, when potentially saving thousands upon thousands of dollars for 3 to 6 months might seem impossible or unrealistic, an extremely large goal. And as we've seen, $500 to $1,000, it might feel more achievable, and people might be able to imagine or picture themselves breaking that goal down to be able to save that amount of money. And ultimately, having $500 to $1,000 can help clients avoid debt. And once people see they were able to save $500, then they can expand that goal, work towards $1,000 or 1 month living expense or 3 months, etc., and break it down week by week into longer term goal. Next slide, please. Thank you. Okay, so I'm going to go over the saving plans tool that you see in front of you in the toolkit, and it's meant to break savings goals up into more manageable pieces to help your client achieve savings goals and deal with unexpected expenses. So it's meant to build a personalized safety net 1 week at a time, smaller steps towards the goal. So if you'll go ahead and please open the tool so we can take a look. Thank you. So we can see on page 1, it's the getting started page, which we see on all of the tools in the toolkit. Page 1 just goes over what the plan does and how to use the tool. So if you'll scroll down to the bottom, please, thank you. Awesome. Yeah, right there. So you can see that there's a clearly labeled 5-step process for how you or your client can use this tool, which I'll walk us through right now. So first step is to pick a reason for savings. Maybe this is to start an emergency fund, or maybe it's connected to a SMART goal that the client set for module 1, which we went over in the last training. Then the next step is figuring out how much money the client's going to need to save for that goal and how many weeks they have to save. Then we can divide the amount of money needed by the number of weeks needed required for that savings goal, and then that gives us our weekly savings goal. So then you can brainstorm ways to decrease spending or increase income to be able to meet that savings target. And I don't know about you all, but math is not my favorite thing. So thankfully, the tool auto-generates, so it'll do the math for you. So Emily's going to show us, just based on the example here, if someone's trying to save $1,000 and they have 40 weeks, then they need to save $25 per week to be able to achieve that goal in the time frame that they've set. And below, there's a space for you to put ways that you're going to meet that 25. So cutting down, for example, reducing your cable to a different quality to save money, or cutting down on eating out to be able to hit that $25 weekly goal. And that was this tool. So now I'm going to pass it off to Hannah, who's joining us. She's a public benefits attorney from Solid Ground, and she's here to talk about asset limits today. So thank you so much, Hannah.
Hi, everyone. Nice to be here today. I believe somebody was going to pull up the worksheet.
Hannah, you're a little bit
Try-
quiet. Is there any way
Oh.
to increase your
Yes.
audio?
So let me just have my heat blasting. Is that any better?
A tiny little bit better.
Okay, let me just adjust. Sorry, everyone. I'm trying to go to my settings so I can. Is that any better?
Yes, that's good.
Okay, I'm gonna just sound like I'm yelling. Sorry, everybody. So is it possible for someone to pull up the worksheet?
Jason, do you want to do it, or I can do it too, because I have it available?
If you have it handy, please.
Okay, I'll do it
Thank
then.
you.
Okay, I could try to share my screen, but that would probably take me another 10 minutes to figure out how to do that. So that would be great. Okay, thank you. So I'm Hannah. I'm a benefits attorney with Solid Ground, a benefits legal assistance program. We offer free legal services for people who are having problems with their public benefits. So that's DSHS, DCYF, and some healthcare authority issues. So I will pop our intake number and email address in our chat and our website. So if you guys have any questions for yourself or clients, we're always available to take referrals, but also if you just have questions or need additional training materials. My own little disclaimer is that what I'm going to present today, it's just an overview. It's not a comprehensive deep dive into asset limits, which could be 2-hour-long training by itself. So, my disclaimer is always check the rules for whatever program you're applying for, your clients are applying for, and you can usually find the rules pretty easily on the website of the department. So DSHS's website, Medicare, healthcare authority. And again, if you're having any trouble finding that, just reach out and we're happy to help. So the first program here is Social Security Disability Insurance. It's a federal benefit for people who are unable to work due to a disability, and they've paid into the system, they have enough work history. It's not an income tested or asset tested resource, so they don't have an asset limit for you, which is great. The next program is Supplemental Security Income, or SSI. That is also for people who are unable to work due to a disability, but usually for some reason they're not able to get SSDI. So they might be a child or an adult with no work history, or maybe you just haven't worked recently enough. So that does have a resource limit. It's $2,000 for individuals and $3,000 if you're a couple. And one thing that I meant to mention before is when we say asset limits, sometimes non-cash assets also could put you towards that limit. So if you have a second car, depending on how much that car costs, a second piece of property, a burial fund, a life insurance policy. So again, it's different for each program, but just double check, because it's possible that something other than cash in your bank account might actually count as a resource. So the next program is SNAP, Supplemental Nutrition Assistance Program. In Washington State, we call that basic food or state food assistance. So it's the benefits that show up on the EBT card. This is one of those benefits that it depends. It's a very lawyerly answer. It kind of depends on who you are and who's in your household. So if you have an elderly individual, so someone over 65, or someone who has a disability, then your asset limit is $3,500. For everybody else, it's $2,250. But there's another, it depends, mark right here. If your household is considered to be, it's called categorically eligible, then actually there is no asset limit. DSHS won't even look at your assets. And there are a couple ways to be considered categorically eligible, but the most common one is if your household income 200% of the federal poverty limit for your household size, you're considered categorically eligible, and DSHS, they won't even ask to look at your resources, except in a few situations. Of course, there's like 3 or 4 reasons why they may ask to look at resources. So if you're applying, or your clients are applying and DSHS is asking for additional resource information, generally it's always good to give that information timely so that the application doesn't get denied. But if you have any question about what they're asking for, or maybe think, I didn't think they needed to know that information, you can always reach out to us and we can answer any of those questions. The next one is TANF, which is a cash assistance program for families. So you have to have at least 1 minor child to get TANF. This one's pretty straightforward. It's $6,000 asset limit for everybody that's getting TANF. The next one is the Low Income Home Energy Assistance Program, which actually provides help paying for utilities. And there's no asset limit for this program. There are income limits, but no asset limits. And, I'm really just going to read right off of my sheet here. In King County, this program is administered by the Multi-Service Center for South King County residents, Hopelink for East and North King County residents, and Public Health Seattle for City of Seattle residents. So you're going to want to contact whichever is your provider for more eligibility. Public housing, I left it blank because it really depends on what housing you're in and who's running that. So I believe someone else today might cover that. So I'll skip that and move to the next page. So the worksheet, as they mentioned at the beginning of the presentation, this is a worksheet by, I think, kind of a national group. So it says Family Medicaid. In Washington, we would call that MAGI Medicaid. It stands for Modified Adjusted Gross Income. You don't have to remember that. That's just the acronym. And so there's no asset limit for MAGI Medicare programs. Again, things are based on income, but for this program, not asset related. But an important thing I wanted to point out is there's actually several different types of Medicaid programs in Washington state. So we have something called Classic Medicaid or SSI related Medicaid. And then there are long-term care programs that are Medicaid, and those do have asset limits. So just always important to double check what program you're applying for, or if your clients are already on a program and you're not sure, to figure out what kind of Medicaid you're on and then double check the asset limits for that. Medicaid Part D, the Extra Help Subsidy, is a really great program. It actually provides subsidies and discounts when getting prescription medications, and it will cap the amount of out-of-pocket expenses you have to pay for generic and brand names. So really great program. If you are what's called dual eligible, so that means you're getting Medicare and Medicaid, you are usually just automatically enrolled in this Extra Help program. I say usually because it happens that, we've gotten clients that they should be on this program, but they aren't, so we have to help them apply. Anybody can apply on Social Security's website. It's ssa.gov. You just look for Extra Help and can apply for it. Now, if you're only receiving Medicare, then you do actually have to file an application, and there are asset limits for this program. It's $7,860 for an individual or $11,800 for a couple. And all the numbers I'm giving you today, it's for the full subsidy amount. There is actually a partial subsidy amount, which is, you have to pay more than if you were getting the full, but it will still provide a cap and, it could still be helpful. So if you have higher income or higher asset limits, it's still worth it to check out this program. The next one is the Medicare Savings Program, also another great state benefit. This will actually pay for your Medicare premiums. So instead of paying $150 out of pocket every month, the state will actually pay that for you. There's a couple different programs within the Medicare Savings Program, depending on your income level, and they offer different benefits, but at the very least, they'll cover some or all of your Medicare premiums. And the asset limits for that program are, again, $7,860 for an individual or $11,800 for a couple. And you can apply for that program through DSHS or one of the local Medicare programs. Again, usually people are automatically enrolled, but not always. So you may have to do an application. So I always tell people to double check because it's a really good program to be on. And then the last one is CHIP, which is health insurance for children. And in Washington State, it's actually called Apple Health for Kids, I believe is what it's called. So this provides free or low cost, meaning low premium coverage for kids. It is based on income, but there's no asset limit. So that's another great program to, if you're income eligible, they won't even look at your income limits. And that covers the worksheet. There's a few extra notes at the end, things that I've mentioned before. And of course, if anyone has any questions, I'll provide our contact information and our intake if you or a client needs help. And I don't know if there's any questions already in the chat, but if we have time, I'm happy to answer those. Or
I have
hold
a
them for the end.
question.
Yes.
So how long, if they do go above that asset limit, say, and they're already enrolled, how long do they have to spend down that asset limit?
Yeah, a great question. It is, of course, the caveat, it always depends on the program. So for example, if you're getting SSI, like the month that you receive that $1,000 gift, it's counted as income. If you still have it by the next month, it's a resource, it's an asset. So by that second month, if you still have it, it's going to put you over the asset limit. The good thing about SNAP is that if you're categorically eligible, they won't ask about the asset limit. Trying to think of another example. So generally it's, the month that you receive something, it's income, but then if you still have it, the first day of the next month, it's going to be a resource. That's not to say that if you get money and spend it before the end of the month, it could still be considered income. So you might still have to report that. So I would just say, if you have a question, double check the rules or let us know for the specific program, and then we can make sure to give you the right information, the right program.
Awesome, thank you.
Yes.
We have another very good question in the chat. Are these numbers monthly or annual income or asset limits?
Yes. So it's basically, if you ever have more than that in your bank account, you're going to be over the asset limit. So you might be over the asset limit for 1 month, and so you're not eligible for benefits for that month. So let's say, for example, you do have an asset limit for SNAP and you go over it, but then you're below the asset limit. You might not necessarily be terminated right then and there, but you might have had an overpayment. You shouldn't have gotten benefits for December, so now you might have to pay that back. That's just like a very simple explanation. So yeah, it's really at any point, if you have more than that in your bank account, any month or any day, then you're over the limit.
Thank you so much, Hannah. We're going to touch on things like overpayments, sanctions, and things like that at future trainings here. But could you just take a couple of minutes here to sort of explain what sort of public benefit cases your team takes on and how best to refer a potentially eligible client to your services?
Yes, absolutely. So we, again, it's free legal services, so we don't charge for our clients. We use the same kind of income. Our clients have to be low income, and we do applications, denials, terminations, overpayments. If there's an allegation of fraud for these public benefits, we take all those sorts of cases, and we deal with DSHS benefits. So it's food, TANF, ABD, HEN. We also do DCYF, child care, so work in connections, child care subsidies. We deal with those cases. For Medicaid cases, it's usually financial. So if somebody is being terminated because they're over a limit, or they say they're not eligible for a resource issue, we take those cases. If somebody's having a problem with getting a caregiver or something like that, we don't take those cases, but we can refer the client to the right local organizations that do that. Oh, and we have an intake phone number and an email. I'll put that in the chat right now before I forget. And then that's usually the best way to get a hold of us. Yeah.
Wonderful. And then before we go, let's have just one more quick question here. When folks are maybe kicked off a program due to exceeding their asset limits, does that mean that they need to reapply automatically, or what does that look like?
Yeah. One thing, because I'm a lawyer, I have to say this. If you get a letter from DSHS and you think it's not correct, you have a right to request a hearing. If you request that hearing within 10 days of getting the letter, the date on the letter, you can ask for continuing benefits. So you can actually keep getting the benefits that you're getting. And that's really great, because then you may not miss any of those payments. Even if you're past 10 days, you can always request a hearing if you think something is wrong. If you were over the asset limit, then you are going to have to reapply and just be prepared to show that you're no longer under the asset limit. And you might have to explain, well, I paid all these medical bills and that's why I'm below the asset limit. So, generally you might have to reapply if what they say is true. But if not, or you disagree, you can always ask for a hearing. And then if you win at your hearing, or you have our help and we help you win at the hearing, you might not have to reapply in that situation.
Wonderful. Hannah, thank you so much. This is such a valuable resource to know about in the community. We will definitely make sure to share your email and your intake line phone number in the follow-up, so folks can direct their clients to you should they need to.
Great.
Hey, Jason, it looks like there's one more question in the chat for Hannah.
Thank you. And this is from Jem. Is there a certain number of months of being over your asset limits before you are terminated from the benefit you're receiving?
Great question. And I know I'm going to pull the lawyerly answer again, but it depends on if we're talking about like a federal benefit for Social Security or the different state benefits. So what I can do, if it's helpful, is provide some more specifics. Maybe email that information to Jason, and then that could get out. I could actually say, okay, TANF is this, Social Security is this. Because if I say usually now, and it's a different program, that probably isn't helpful. So I'm happy to provide that follow-up information.
That would be awesome. Thank you, Hannah.
Yep, absolutely. All right, thank you, everybody. I'll put our contact information in the chat right now.
Thank you, Hannah. All right, we're going to continue along with our savings training through the toolkit module 2. I think it's 2, maybe it's 3. I might be forgetting. Sorry. So now we want to talk about finding a place to save your money. Where are you going to put it? So I would like to offer up a question for people to answer in the chat. Where do you save your money? Where do you think you can save your money? Where do your clients save their money, etc. So I'll give you some time to respond to that. Savings account, yep, through a bank. Bank account, credit union, IRA, credit union. Prepaid cards. cash in your home with family or friends. Yep. On yourself. Yep, you can keep it just with yourself. Savings account, keeping a place on hand to hold extra cash or spare change. Yep, I've definitely seen people do like envelope savings that they just put as $5 in every month. So when talking about where you're going to save, one of the things to consider is what are the benefits and what are the risks. A benefit is something that provides you with an advantage. A benefit is good for you. A risk is a chance of loss. Risks have uncertain outcomes, which can lead to, a little anxiety. So now we are going to go to the next slide and look at a tool that kind of helps you decide which is the best place to save your money. So like in the beginning of most tools, this first part just gives you kind of an overview of what to use the tool for and how you can use it, and I guess what its purpose is. It helps you weigh the benefits and risks of each different place that you could save your money in. So the first one it goes over, we're going to go through this, is a bank account or a credit union, which lots of you had shared. And that has big benefits. Money is protected. It's federally insured up to $250,000. It can't be lost or stolen, or if it is, it can be replaced. It's normally generally replaced by the federal because it's federally insured. The risk to this may be, if you aren't good at keeping it all up to date, you could end up with overdraft fees or balance fees, or there's just all sorts of different fees when it comes to banks. Not as much with credit unions, but with banks for sure, because they are for-profit organizations. And then it also, depending on your history of banking, it could be difficult to actually get a bank account, which again, it is slightly easier at credit unions, but it can still be a concern. And then if you see, it says questions I have on the side, that's where your client could kind of put in what they're thinking. And if they're like, well, yes, this is good, and weigh out those pros and cons. All right, we'll go down to the next one, which is saving with a family member or a friend. Benefit is it costs nothing to maintain it. There's no fees. There's no, a family member could charge you interest potentially, but probably not. Probably only if you're getting a loan from them. But yeah, no cost to maintain it. But there are risks. It could be lost or stolen. In this case, it talks about like a natural disaster or a fire, which we don't see too often, but they do happen. And then it could also put your friend or your family member at risk for someone trying to come after them to try and steal your money, depending on how much they're keeping in one place. And then it could also put you at risk, because what if your family member spends your money and betrays your trust? It's, money's a tough thing, and it's hard to know, like in a moment, like if they have a crisis, if they're not just going to go grab your money because that's what they have available, or if they are trustworthy. Money is just one of those complicated things that it can put a lot of strain on a relationship. The next is keeping it in your home. Well, that's, again, no cost to maintain, very easy to access, and very convenient. But there are risks. It could be also lost or stolen or destroyed in a natural disaster, fire, etc. And it could also put you at risk of home invasion, depending on how much money you have and how many people know that you have this money on hand or these assets on hand. The next one is prepaid cards. So these are really great, and I have a lot of clients that use these. They're easy to access, they're convenient. You don't have to be approved for a bank or credit account, but there are some risks. They could have fees for activating, for loading on the funds, or for even just using your card, withdrawing money, etc. And it doesn't not all of them have the same protections as a bank account. So if you lose your card, you may not be able to get that money back, versus if you lose your debit card from your bank, your money's still there. And so for that, it does have a note that you should check the card agreement before you sign up and make sure you understand all the fees and how it does, what works, what happens if you lose your card, what their process is for that. And then lastly is US saving bonds. I have had experience with these. They're a really good resource in the sense that they can't be lost or destroyed. If you have a paper bond, the funds will still be recovered. It's in a system. But part of the problem with those is when you buy a bond, you have to wait a long time for them to actually gain that interest for it to be that full amount. And like me, I had ones every year for Christmas from my grandpa for $50. And when I went to college, they still it hadn't been long enough to actually mature. So those can take a lot more longer for them to actually gain that full funding, which also means that it's not really accessible savings. It's kind of more, it's like an IRA or something where it's not as accessible, or if you do access it early, there can be penalties and loss of funds. All right, well, that's that tool. Next slide, please. Oh, no. Hold on, we're going back. All right, so this is saving at tax time. And the reason that this is brought up is because a lot of the time our clients, their main huge chunk of money that they get in a year is their tax return. And a tax return is a great way to start a savings account. For us, let's see. Oh, so there are 2 links on here. We can go to the first one, and that one shares just basically explaining that if you are filing for a child tax credit or an earned income tax credit, it can delay your tax return because IRS has to do extra checks on those ones because it's additional funding that they are sending out. And this link just gives you more information on that if your clients have questions or if you do. And then the second link on our slide actually takes us to our local free tax clinic help, which is through United Way, King County. And right now it's not up to date for 2021 tax season, but this is where you will be able to access that information. And if you scroll down, there's a bunch of different resources and information in general about filing your taxes that you can use. So it's just a really good resource, even just to prep your clients for when they do want to file their taxes. And now we'll go to our tax handout that the CFPB has put out. So this just kind of goes over the different parts of things that you can do with saving for taxes. So it says, it's talking about it's a really good time to take advantage of saving when you get this tax return. And we just showed you United King County. And so if you look at that that first section, it talks about free tax services. United Way is actually funded through this federal voluntary income tax assistance. And so they're our local one. But if you're, say you're trying to help somebody in a different county or out of state, you can go to that website or call that number at the bottom, and they will tell you who your local free tax services provider is. And then it talks about understanding fees for paid preparers. So if you're going to H&R Block or any of the tax places that you do have to pay a fee, the one thing to note about this is that if you decide to pay them with your refund, that's called a refund anticipation check. So that's where they take their fee out of your refund. The thing with that is you think it might cause it to get faster. It's not going to affect your tax return. You're not going to get it any faster. And they can actually often charge additional costs to get paid that way. So you are losing some of your income. The fastest way, though, to get your tax return is to file and get direct deposit. It's way faster than a check or a card account that they might send you in the mail. Yes, and I guess I skipped ahead a little there. But then the other thing we want to talk about is to make sure that, you know, if you qualify for any of these tax credits, like the earned income tax credit or the child tax credit, that can be a significant amount of extra funds that you can get. I mean, I've seen clients with like 4 kids get like $8,000, and that's, for some of them, that's like half of their income for the whole year. So that's something that, you know, as we're coming into tax season with our clients, it's a great thing to consider using our SMART goal that we had shared in one of our previous trainings worksheet to help clients kind of work through and be like, all right, this is how much money I'm getting. This is the bills and things I need to pay, but I do want to start a savings. So how do I want to do that? And then you can go back and try and decide where you're going to put that savings in the previous tool. An honest tool from the beginning as well. Put in the money you have, put in what you want, and it'll tell you, you know, if you want to do weekly, how much you need to save to add to that. And then, yeah, that's taxes. Does anyone have any questions? I'll try to answer. I'm not fully an expert on taxes, but I've, you know, got an understanding of this material.
Well, I just want to plug, as Joy highlighted, there's a lot of benefits to helping the folks you work with set up a direct deposit through an account. If you check out our coalition website on some of our prior financial empowerment trainings, we have information about accessible banking services, including tips for what to be looking for from a bank or a credit union, and some links to the Financial Empowerment Network and Bank on Seattle-King County, which has some good information about sort of how to negotiate those decisions with the folks that you're working with.
And there was a question in the chat. I think you actually have this information, probably have a better understanding, Jason, of the resources for the unemployment and PUA benefits.
Yeah, that's an interesting question. The one thing that I know of is the stimulus payments, the economic impact payments for folks who may not have claimed their stimulus check. You actually can, in theory at least, still claim that benefit through filing your taxes. So if you're working with folks who were not able to claim that benefit, who haven't filed in a few years, it might be worth having that conversation with them. Previously, there was a way to get the money without filing back taxes. I think at this point, probably filing your 2020 taxes is going to be the main avenue to get that. In terms of how things like unemployment and like emergency assistance funds might get calculated, I don't know that offhand. We'll see if we can follow up with that information.
Then we had a question, do you know if H&R Block or other tax preps have any hidden fees? Specifically for each tax preparation company, I don't know, but I've definitely reviewed many of my clients who've gone to them and found those hidden fees that, you know, they didn't expect in their paper handout explaining what they paid for. So it's always good to, before you decide to file with them, to really read through that contract and make sure that you aren't having any hidden fees. And then Adrian, I'm interested in hearing more about prepaid card savings resources. A client recently told me about a savings pod through Current, and I really know very little about this kind of product after plugging Express Union, etc. for many years. Many of my clients have difficulty getting banked due to the issues on their check system records. Yeah, so that's actually something that I'm just starting to kind of get more experience with and learn a little bit more about. And they seem really helpful for our clients that can't be banked. The main thing though is just really reading through their fine lines to find out, if you lose the card, do you lose your money? Because that has happened. So kind of making sure, is your fund secured in any way? Are they insured? And is there any way that they could? Yes, and then yes, Adrian, and hidden fees. And are there any hidden fees in there? Like, every time you use your card, are they going to take 50 cents or $1? Like, if you have a limited income, that can add up really quickly. Well, thank you all for all the questions. Now Anna's going to finish up with our last section.
Awesome, thank you. So as we've discussed, and as you've seen, Module 2 has 3 tools and 3 handouts to help you empower clients to take steps to build savings and to think about places to keep money set aside. And also, we've detailed asset limits and how people can use their tax refund to kickstart their savings journey. One of my favorite parts about the Your Money, Your Goals toolkit is that the handouts and the tools, they don't have to be used in order. You can take a tool depending on what's going on in the client's life or how much time you have for the client. So for example, if you only have 10 minutes with a client, then you can work on making a savings plan to figure out a monthly or a weekly savings target. If you have 30 minutes, then you can complete the savings plan. You can use a finding a place for savings tool to pick a place that's right for your client to keep their savings. Or if you have multiple sessions with a client, then you can review the savings at tax time handout for tips on prioritization with savings when it comes to tax refunds. And you can use the savings and asset limits tool to get a clearer picture of how much you can save while maintaining your public benefits. So to wrap it all up, to kind of restate what we've said throughout the training, savings is money that you set aside today to use in the future. And people save for many, many reasons. That could include emergency fund or goals that they set for themselves, such as buying a new TV, purchasing a home, paying for their child's education, or retirement. And saving for emergencies is extremely, extremely vital because we know that emergencies happen in life. So it's good to plan for them. And we also discussed that $500 to $1,000 in emergency fund can have massive benefit for clients, and it's a great place to start with a savings fund. And when you save for emergencies in advance, it's easier for clients to handle those emergencies without having to skip other bills or borrow money. And we know that when folks borrow money, oftentimes there's fees or sometimes interest. So saving money now for unexpected expenses and emergencies will save money later down the line. So thank you for listening to me. And I'm going to pass it off to Jason to give some sketch related updates. Thank you, Jason.
Thank you. Just want to round out the meeting with just a few more just quick updates for folks. Those of you who attended our last training heard my spiel about the subsidized annual pass program. I'm going to say it again because this is such an exciting resource that the coalition and our community advocacy partners have been fighting for a very long time. Sound Transit and King County Metro are now offering free ORCA cards for people who are enrolled in specific public assistance programs. The ORCA Lift program was established in 2015, and while that was a pretty historic achievement, the $50 a month cost is still a barrier to folks that are low to no income. So despite the recession and the cuts to transit service that are being considered, our local transit agencies are still moving forward with this, which is really exciting. The thing to note about this is that they're not looking at income directly to qualify someone for these bus cards. They're looking at whether or not someone is enrolled in one of these 6 public assistance programs. That's TANF, Refugee Cash Assistance, Age, Blind, or Disabled, or Housing or Essential Needs, Pregnant Women's Assistance, or SSI, Supplemental Security Income. So if you're working with someone who is eligible for this, the most important thing you can do to help them is to help secure evidence of their benefit enrollment. Folks might be familiar with BVS, the Benefit Verification System. It's the program that the state uses, and that's usually the readout that clients get when they have their benefit confirmation mailed to them. If you don't have that, sometimes they are willing to use things like copies of bank statements or some other notification postmarked from DSHS. But again, it's not necessarily based on income, it's based on being enrolled in one of these programs. So be thinking about how you can acquire that paperwork if you're helping someone apply. There are 3 agencies that are enrolling folks at the moment. DSHS is the main agency. The best way to get a hold of them is to give them a call at the 1-800 number there. Public Health is also enrolling folks, both in person. They have one location down in Federal Way, as well as one location in downtown Seattle that are available for walk-ins, although they do encourage folks to use the phone number for COVID reasons. And then Catholic Community Services is the 3rd agency that is working with folks. We have information. We both can share out the information provided by King County Metro, as well as resources on our website that include how best to follow up. Again, for anyone who is receiving one of these public assistance programs, they are eligible to receive a free bus pass. Please contact one of those organizations for more information. And then really quickly, I just want to plug an event that the Coalition would like to warmly invite you to. The Coalition hosts monthly membership meetings on the 3rd Thursday of every month from 9 a.m. to 10:30 a.m. We use this as a space to share resources, highlight local advocacy opportunities, and really sort of build strength, power, and solidarity as a movement of providers and housing justice advocates. Since the state legislature is going to be convening in January and we'll be discussing big ticket items like the state budget for the next 2 years, as well as considering legislation related to housing and homelessness, we're going to use our December meeting to sort of talk about what we expect from the legislature and kind of preview some of the bills that we think are going to be important or needing attention. We are going to be inviting lawmakers from across King County to come to talk to us about what their priorities are and what some of the bills that they're working on are. And then we will also be joined by some of our statewide advocacy partners to sort of explain how to help your clients provide testimony in support of this legislation and sort of understand what advocacy looks like. In previous years, our organization rents a big bus and we drive a bunch of people down for a many person lobby day, which can't happen this year because the legislature will be meeting remotely. So we're going to be focusing on how to provide virtual testimony and what that looks like in terms of engaging your coworkers as direct service providers and your clients who have the relevant lived experience that really need to have their voices elevated in this process. I've put the registration link to our legislative preview meeting in the chat. We would love to see you all there. And please do sign up for Coalition updates as we want to make sure that you know what's going on and how to use your voice to speak up. And then I believe that that's all I have today. Okay, wonderful. Well, again, thank you all so much for being with us here today. It's really a pleasure to bring this training series to you. We have typically been meeting on the 4th Wednesday of the month from 11 to noon. Next month will be the same. We're going to be meeting on Wednesday, January the 27th from 11 a.m. to noon to talk about tracking income and benefits. So we'll be expanding upon a little bit of the conversation we had today about public benefit eligibility and kind of give you some tools to help your clients think through some of those things. Folks, the Consumer Financial Protection Bureau does have a post-event survey, which I put a link to in the chat there. This will allow you to, I think, get credit for participating in this training series and signing up for further information. And finally, our next workshop on January 27th, I'm going to put a sign-up link in the chat as well. You should also get that in the follow-up email. Does anyone have any questions on what we covered before we close out for today? All right, well, I will let you folks get off the call 1 minute early. Thank you all so much for being here for this training. Yes, a copy of these slides as well as all of the tools that we discuss are going to be provided in the follow-up email, which you should receive tomorrow. And please do share that information with the folks you work with as well. Thank you, everyone. Look forward to seeing you next month.
Hey, Jason, I got a quick question.